Health Data Compass is part of the Colorado Center for Personalized Medicine. The center's mission and objective is to try to bring breakthrough medical advances in the field of personalized medicine. Compass itself is the data warehouse and has the responsibility to integrate data from 2 major hospital systems and a physician billing plan, as well as the scientific laboratories from University of Colorado, Denver.
The research agenda is quite different in that it really requires access to a very broad range of data. And the types of questions that researchers ask are also equally broad and wide. And therefore, the architecture and the design of Health Data Compass is very different and very unique for the services it provides to campus.
Compass was initially established on the idea that we would build a very traditional data warehouse. So we sought out and selected and implemented a traditional on-premises data warehousing technology stack. We found ourselves under this barrage of tasks that all had to do with simply keeping our on-premises infrastructure afloat. Updates for new software features and security patches and maintenance and internal networking issues. And we were spending a lot of our time and money just keeping the lights on and not actually advancing the project to the point where we could deliver great services. We started thinking there had to be a better way, and we started taking a close look at the cloud. We had 3 main objectives when moving to the cloud. First and foremost was security. Second was we were hoping to get out from under this tremendous maintenance burden of the on-premises infrastructure. Third was to develop our systems in a way that would be easier and more efficient for our internal technical team to use, as well as faster and more friendly for our customer base to get their hands on. We chose the cloud as our target environment for a variety of reasons. In the first place, it's very secure. We're confident that their ability to keep our data safe in their data centers far exceeds anything that we can do here in our own. In the second case, we are able to accomplish things in a way that is automatically scaling, both in terms of performance and in cost. And the beautiful thing for that is that's money that now we redirect into our services team, into procurement of more and interesting data sources, into better analytical tools, and in the end, drive more value back to our customers. Personalized medicine isn't new, it's something doctors have been doing forever. What is new is the ability to expose to the doctors information about that patient like they have never seen before. Virtually every disease will be affected to some extent or another by the data that Compass is collecting and aggregating for our researchers. We load the data in, we never run out of space. We execute our queries, we never run out of performance power. And we will have delivered on our mission when we give them the ability to find relationships between all of that data and the patient who is sitting right there in front of them, and to make better decisions about how to treat that patient's disease, how to diagnose it more accurately, how to help them get better sooner at less cost.
When you select an outside vendor, what you're seeking is that they bring to the table experiences that they've had from other engagements. And Perficient has been really outstanding in this regard.
They have a great local team in Denver, as well as a national presence and a large pool of talent to draw from. And we have drawn from that talent pool for everything from system administration to database administration to BI development, ETL development, and everything in between. Perficient has given us honest feedback on ways that we might improve the ways that we're doing things, and they have taken ours when we've asked for certain changes in the services that they're providing to us.
It really has felt like a bilateral relationship and partnership, and this has been really helpful to the success of the project along the way. My advice to other organizations who are just beginning this journey is to begin with the cloud. Since we've moved to the cloud, we have been able to innovate at a speed and a cost that simply was not possible prior to that. The data are all on the cloud, the computation are on the cloud, innovation is occurring on the cloud. It really is the architecture of the future.